I'm Dr. Ed Hengel, and I'm a chiropractor in St. Louis. I've been practicing for 28 years. A common problem that we see are runners that have lateral knee pain. That knee pain happens to exist a lot of times right here, lateral to the knee and just superior where the iliotibial band comes down to its insertion point. So an easy way for you to treat that at home is rest, ice, compress, and elevate. Remember the word RICE. So when you're rested, take a break from your regular routine of running or your scheduled workouts. When you use ice, 25 to 30 minutes with a gel type pack that conforms to the contours of your skin. So secure the ice pack to the skin using some type of an ACE bandage or Velcro strap and hold that there for 25 to 30 minutes at a time. The next thing you can do is to compress. When you use compression, use a compression type stocking that's going to help dispel some of the inflammation and swelling in that area. And so that's compression. So the next part is elevation. So go ahead and lie on your back. What we do with our patients at our office is to elevate their legs so that the affected area is higher than their heart. So remember the words RICE, rest, ice, compress, and elevate. I'm Ed Hengel with the Afton Lee May Chiropractic Center, wanting to thank you and good health and good luck.